Good morning, I'm Luca Macchiarola, the presenter of this study that was born from a collaboration between the Hayek Clinic in Luxembourg, their sport clinic, and the sport clinic of the Rizzoli Orthopaedic Institute in Bologna. Our study is entitled Side-to-Side Anterior Tibial Translation on Monopodal Weight-Bearing X-rays as a sign of knee decompensation in ACL deficient knees. The background of this study is that anterior tibial translation was recognized long time ago by de Jure as an indirect sign of ACL deficiency. MRI studies were conducted during the recent years that correlated anterior tibial translation with the chronicity of the ACL deficiency, with multiple ACL failure, major knee laxities, and poor clinical outcomes in the long term. So therefore, the concept of sagittal decompensation of the ACL deficient knees started to come out. Anyway, MRI is not adequate, in our opinion, to evaluate the sagittal decompensation, because no knee loading is possible in the supine position of the MRI, and therefore no soft tissue restraint or compensatory mechanism are possible in the ACL deficient knees. Therefore, the aim of our study was to evaluate the influence of time from injury of the tibial slope and the meniscal lesion on side-to-side anterior tibial translations as measured on bilateral monopodal weight-bearing X-rays in both primary and secondary ACL deficiency. Our hypothesis is that side-to-side difference is a parameter which is influenced by the time from injury and the presence of meniscal lesion. This will lead to the supporting of the concept of gradual sagittal decompensation in the ACL deficient knees. Our study was designed as a retrospective observational cohort study. Therefore, the Hayek Clinic database was searched for this inclusion for patients presenting these inclusion criteria, which were primary or secondary ACL deficiency, and by the presence of a bilateral weight-bearing knee X-rays performed from 15 to 20 degrees of flexion according to the study conducted by de Jure. Data for these patients were extracted including sex, date of birth, date of injury, date of X-ray and MRI, primary or secondary ACL deficiency. It is to be noted that for patients with secondary ACL deficiency, the date of the initial ACL injury was considered, and the presence of meniscal lesion were assessed by a radiologist and by an orthopedic surgeon. In this slide you can see our measurement method, which were described for the first time by de Jure in 1994. These are really straightforward and present a good to excellent intra and inter-rater reliability. This is the statistic that we have been using SPSS. We assessed our data with paired t-test, Pearson coefficient R, and independent t-test according to the nature of our data. Also, a multiple linear regression analysis was computed in order to evaluate the influence of time from injury and meniscal lesions on the side-to-side anterior tibial translation. This is our demographic data. So in the end, 69 patients were included, 43 males and 26 females. Age at weight-bearing radiograph was 27, and median time from injury was 2.7 years. There was no difference between male and female patients in the preoperative data. There was moderate correlation between anterior tibial translation and posterior tibial slope, both in the affected knees and the healthy knees. As regards the measured parameters, there was a significant increase in the anterior tibial translation of the affected knee in comparison with the healthy knees. Also, anterior tibial translation was significantly increased in secondary ACL deficient knees and if at least one meniscal lesion was present. Side-to-side difference anterior tibial translation was instead significantly increased in secondary ACL deficiency if time from injury was greater than 4 years and if at least one meniscal lesion was present. Our multiple regression model showed that in primary ACL deficiency with no meniscal tear and time from injury less than 4 years, the side-to-side difference expected was 1.3 mm. If only one of these parameters was present, so if one meniscal tear or at the time from injury less than more than 4 years, the side-to-side difference remained the same, and both of these parameters had to be modified in order to find a difference in the side-to-side difference translation. In secondary ACL deficient knee, instead, side-to-side difference was mainly influenced by the presence of a meniscal tear, underlining the importance of a meniscal repair, especially in secondary ACL deficiency. So to conclude, the side-to-side difference in loading condition is significantly increased in secondary ACL deficient knees, time from injury more than 4 years, and if at least one meniscal tear is present. Our findings support the concept of gradual sagittal decompensation in ACL deficient knees over time and point out the importance of a meniscal repair, especially in secondary ACL deficiency, because the menisci are secondary restraint to anterior tibial translation. Clinical relevance is that lateral monopodal weight-bearing X-rays are very appealing in clinical practice to be used in order to evaluate compensation state of the ACL deficient knees. Thanks for your attention.